morning and welcome to High Pass. I'm Dr. Katie Patel. I'm a pediatric emergency medicine physician and medical educator in the Northeast. And today I am happy to have Dr. Stephanie Fontin. She is a general pediatrician in the Southeast. She's affiliated with a quaternary care center, and we're very lucky to have her and talk about how to really excel, stand out, and impress, get honors in your pediatrics clerkship. So welcome, Stephanie. Thank you so much for being here.
Thank you. I'm so excited to be here.
So I wanted to start things off with just asking you, why did you get interested in pediatrics?
Mhm. So I knew from a pretty young age that I not only wanted to be a doctor, but that I loved children. My mom has been a preschool teacher for 30 plus years. But I think as I went through my training, I really got to see that in pediatrics, you not only get to see such a breadth of things with different ages and stages,
Hmm.
but also you get to impact the community, the family, the parents, and that's something that I really enjoyed. I kind of went through my training and thought that I wanted to do what I call local global health, being able to impact communities that need here, in the United States. And I just saw that pediatrics was a great way to be able to do that.
Yeah, definitely. I feel like there's so much advocacy and global health
Mhm.
that just naturally weaves its way into what we do.
Exactly. Exactly. And that's a wonderful thing also to be among colleagues that often have that passion too.
Definitely. So, I wanted to talk about when a third year medical student joins us on rotation, and how can that student really set themselves apart and look like an honors level student and what that means. So, first off, what impresses you in general?
So I think in general, just someone that is excited to be there.
Hmm.
Um, Even though I would love everybody to be in pediatrics, we need other doctors. So I understand that not everybody's going to go into pediatrics, and I'm often really curious about what the med students are interested in as well.
Hmm.
But I think just having that curiosity of what can I learn on this rotation that I can then apply to whatever field I'm going to do in the future, I often look for that kind of thought process.
Yeah, definitely. I feel like one thing that I wish I had done more so looking backwards at my clerkship year was going into
Mhm.
almost every specialty thinking this could be it for me. This
Mhm.
could be my job. I feel like it would have made me show up even a little bit more. And it also
Exactly.
probably would have made me happier every day.
Mhm.
Yeah.
Exactly, exactly. And I think, I'm a general pediatrician, so I have a little bit of that. Like I like a little bit of everything.
Hmm.
Um, but that's exactly how I thought I approached my third year as well. And it made me, just like you said, enjoy it more. Like I was like, okay, maybe I'm not going to do surgery, but I really love this aspect of
Hmm.
surgery. And, now what, like closer into my career, I am able to think about what did I learn on that rotation that I actually use today? And there are
Hmm.
lots of skills. So I think it's really important to not only show up, but to understand, even if this is not my specialty of choice, there's something I can learn here.
Yeah, absolutely. So maybe we can break it down into some specific examples because I think
Hmm.
that really helps the students kind of understand what we mean. So I can obviously speak it from the urgent care, emergency side, and then I'll have you speak to the outpatient side. But some examples I think about are kind of related to maybe your assessment and plan is really going
Hmm.
to set you apart in your third year. I think of a past level student is probably making a differential diagnosis that includes a few
Hmm.
different things. Maybe they're not pediatric specific, but there's at least
Sure.
a little bit of overlap. But that honors level student is going to have a robust differential, at least five
Hmm.
things that come to mind, and they're at
Hmm.
least all pediatric based, meaning even if
Hmm.
it's not even if it's an infectious disease, right, where it
Hmm.
kind of feels a little bit more nebulous to try to pull out those pediatrics
Yeah.
topics, at
Yep.
least you're thinking about what are the most common bugs that are showing up in
Hmm.
this age. Um,
Exactly.
what kind of examples do you have for what would make an honors level student?
Hmm. So thinking about, general pediatrics, continuity clinic type settings, you can see anyone from 2 days old to sometimes, 19 or 20 years old. And I think that's what makes pediatrics really unique and fun, but it can also make it difficult, I see, for a lot of the medical students who
Hmm.
rotate with us, because you often have to switch your brain with how you're doing your exam, how you're asking questions, who you're asking the questions to. So it's not necessarily that I think this is something that you need to know on your very first day. For
Hmm.
example, like our students rotate with us for 2 weeks. But if a student's rotating with me for 2 weeks, I'm really looking for that progression within those 2 weeks of how they're applying, looking at the developmental and stages of a child or a
Hmm.
teenager and how that applies to either doing their exam, asking questions, or even thinking about the differential. So, for example, you might think of something such as, generalized abdominal pain. I think that's something that's really common we see in
Hmm.
outpatient as well as in the ER. So, how are you asking those questions, and what will those symptoms look like when they're really, really young? So, when they're babies, you're obviously asking the questions to the parents, but you might look for like really subtle signs that the child is just not as like playful and giggly as previously, or maybe they're just not wanting to play with the toys. Just a little bit more, a little bit of their life has been taken out of them. So that's something that's completely different than how you would ask a 19-year-old, right? Where
Hmm.
you're maybe going to use some of those like kind of common questions you learn in the adult rotations where you're like, okay, where's the location? Does it radiate? How's your stools? So, it is a huge mind shift oftentimes in pediatrics because that could be your first two patients of the morning. But I'm looking as the students are on, our general pediatrics rotations and learning more about development, that they're utilizing those different skills with different
Hmm.
patients. And to me, that really sets them apart. Because I'm like, oh, they get it. They get it
Hmm.
and understand that, pediatrics is not just all little adults and everybody presents differently depending, you might have a 19-year-old, but they're nonverbal. So how are you going to get a history and physical with that child compared
Hmm.
to a 19-year-old that has the verbal skills almost of an adult? So that's something that I think really puts people apart.
Yeah, definitely. I feel like what I'm hearing from you is that there's almost a pattern recognition to medicine, but also a pattern
Hmm.
recognition to different age groups and being
Yes.
able to frame switch into that. Oh, I need to be in my 3-year-old toddler mindset
Hmm.
versus
Hmm.
my newborn mindset, and just picking up that
Exactly.
pattern of what that patient needs from you when you're going
Hmm.
through a review of systems so that it doesn't look like a carbon copy of an adult.
Exactly. And like I said, it's a skill that we learn as we practice pediatrics. I don't necessarily expect every med student to know it right away, but
Hmm.
I think the questions that they ask me really help me to understand that they're thinking in that mind frame. So they might say like, "Oh, this is a younger child. Like I wonder if I should ask them about daycare." Just
Hmm.
that
Hmm.
that idea that they're actually showing me that they're thinking about the thought processes, even if they don't know all of the answers, which I don't expect at all. And I don't know if we're going to talk about resources, but there are definitely resources that can help you. But I think it's more just thinking in that frame of mind.
Yeah, that sounds great. Yeah, I
Mhm.
mean, I think that why don't we take a beat to talk about some of those resources too? Because I
Mhm.
think that in order to talk about these specific examples of what impresses us, some of the
Mhm.
foundation of that is how are you creating
Yeah,
what you're saying? And so some of that does have to
exactly.
go to resources. So, what
Yeah.
resources are your go-tos? What do you find yourself recommending to med students, trainees?
Mhm. Mhm. Yeah, so like I said, it takes a while to learn. Even our residents are still trying to understand the different development and stages of children. So I don't expect it, med students to have it memorized, but I think it's something that's very useful if you have on your phone, access on your computer or through email, something that can kind of help you to understand the different stages in development. So one really common one would be like the AAP Bright Futures.
Hmm.
So that the AAP publishes and kind of talks about at different common well child checks, for example, like the 6, 9, and 12 months, what are the questions you're going to ask? What would you expect for gross motor development versus fine motor development? So I think that's really helpful. Oftentimes, the students and residents will actually, so I say, okay, I have a 9-month-old here. They're here for their well check. They'll actually review that before even going in so that they
Amazing.
understand how to ask the questions. And you can find it online as well. And there's other developmental resources. Another resource that I really love, just happens to be through the AAP as well, is healthychildren.org. So that's a common a site written by pediatricians for parents that I essentially send to all of my patients' families, as well as my friends that ask me questions all the time too. And I think that's helpful because it often helps you to understand what questions will parents ask.
Hmm.
Because oftentimes the articles are written in that form. So that way, because if you can kind of anticipate what the parents might ask and be able to give some of that anticipatory guidance. So for example, when do I start using fluoride?
Hmm.
Does I have to wait until they're 5 years old? Like I find most people in the general population have no idea. And if you come across that and read that article and then you're like, I now know this piece of information, so I can give them anticipatory guidance. And that's really impressive. I would say that's a resident skill. So if I saw a medical student doing that, I would be
Hmm.
really impressed.
Yeah, definitely. I feel like you're mentioning obviously the vast resources that AAP has to us
Mhm.
and how they also produce Red Book, which helps with infectious
Yep.
disease, like medication tailoring, maybe knowing a
Mhm.
little bit about that. So I feel like just a general AAP Google could really
Yes.
set you up for a lot of success because so
Yeah.
many resources are there and easily accessible.
Yeah, and a lot of their like review articles, which are usually pretty easy to skim even in clinic, because we have limited time in clinic, of course. A lot of them are available for free or access through, the medical school library. So that's really
Mhm.
nice because most of the stuff is accessible.
Yeah. Another thing I think of too is especially when you're creating your plan
Hmm.
in the urgent care or emergency room setting is especially for us where we're affiliated with tertiary coronary care centers, there's
Hmm.
probably already a protocol about how
Yep.
to manage this or even what your first steps would be. And so a
Mhm.
student that searches the intranet for a
Mhm.
protocol and then maybe even looks on that protocol for the resources they use. Those are all evidence-based
Mhm.
guidelines. And so that
Exactly.
student that thinks like, oh, I'm going to follow the protocol, but why am I following
Mhm.
it?
Mhm.
Really sets you
Exactly.
apart from thinking, oh, this is a dehydrated patient. I want to get some labs and give some
Mhm.
fluids. Well, how are you doing it? What labs do you want? And you
Yep.
might be using a protocol that's based off those evidence-based guidelines, AAP-based
Exactly.
guidelines to get you there.
Yep. And then some, I'm familiar with some of the larger children's hospitals guidelines too, because often
Mm,
we
yes.
search and share those with one another for shared common knowledge. And sometimes they even have like history questions. So, like I said, you're on the rotation to learn. We don't expect you to know everything already. If that were the case, you would already be a pediatrician. So, even utilizing some of those guidelines to understand what questions to ask will really
Mhm,
set you apart because it shows that you've done the research.
mhm. Great. One other thing I'm thinking of too is a student in my field is going to go back to the patient. It's not just
Hmm.
a one-time hello visit.
Hmm.
You're at least following up with them multiple times. Maybe that past level student goes back never, or
Yeah.
maybe one time to check in and say hello and kind of do a progress update. But that honors level student is
Mhm.
consistently checking in. What are
Mhm.
our goals for discharge? Are we meeting them?
Yep.
How are we getting
Yep.
there? What does that look like? Or how does that progression of the plan look like on your side? Because obviously it works a little different when you're meeting them for one visit.
Yes, it is a little different. I will say one thing I thought about that I often talk with med students about is especially depending on what clinic you're in. So our continuity clinic, we have a lot of well childs, a lot of children, school age children and under. So we are just like turning out the well child checks. And I think oftentimes the medical students are thinking, okay, this child is coming in for a 7-year-old well child check. I'm going to do my HPI, go over development, go over anticipatory guidance, do the exam, and then I'm done. But what happens when that child is coming in for a 7-year-old well child check, but is also having sleep issues
Mhm,
or is also having headaches? And I think that trips up a lot of our medical students because they're like, okay, how can I both do a well child check and also incorporate, gaining a history and doing a physical pertaining to a particular problem? So
mhm,
that's a little bit of a tricky part of outpatient medicine because sometimes we do ask them to come back, but for the most part, especially with our patient population, we want to be able to kind of tailor the visit to their need as well. So I think one thing that I think about is, kind of do the best you can to kind of do as much as the well child check, but as a med student, we're really looking to see like, can you take a focused history on a problem and kind of tailor your physical exam to that thing in particular? So
Hmm.
when I'm hearing presentations, I'm listening out for that. So was this just like the mom mentioned the problem and then you kind of just skate over it? Or are you
Hmm.
really thinking like, oh, they mentioned headaches, so I did a full neuro exam. So I'm just going to make sure that I present that neuro exam so that you know I was thinking about that. So even though we're not often, sometimes we are. For example, we might have a broncholytic that we suction and then we want to go check back on, or, whatever it might be. So we're sometimes we might check back on children, but that's not very common in
Hmm.
pediatrics, in general pediatrics. But the thing I am looking for is if a problem is presented on top of a well child, are you really also doing a pertinent HPI and physical exam and thinking about your differential for that student? I mean, it's for that patient. And I think that definitely separates, how I see an honor student versus like a pass or a high pass student. Just because, I think this kind of goes to one thing that I kind of don't look for is that I think sometimes people can be like, okay, general pediatrics, it's kind of like monotonous. We see well child
Hmm.
after well child check. But when you really think about it and you think about the different problems that they're bringing within the well child check, every patient is so individual and
Hmm.
needs to have, a tailored history and exam to them. So that's one of the things that I look for, not only enthusiasm in being there, but also being like, oh, okay, they brought up a problem. This is now, I'm looking at this differently now, and let me make sure I do a history and physical that pertains to the problem they brought up.
Yeah. It sounds like the student that we're looking for, that honors level student, is really like getting to the why of why they're doing
Mhm.
things. So I'm
Yep.
not just here to run through
Mhm.
15 chief concerns. I'm not here to run through
Exactly.
15 well child checks. I'm here to think, what is your concern today,
Mhm. Mhm.
and how do I react to that in your setting, at your age, in the season
Yep.
of the patient that I'm looking at, and then
Mhm.
whatever I choose to do, why am I doing that?
Exactly. And I think one tip to kind of, because it can be kind of intimidating. I
Yeah.
I notice with a lot of our medical students that come, they're like, the well childs just have so much information to review, so
Hmm.
much disciplinary guidance,
Yeah.
and I definitely empathize. I understand that. I think one thing that can be helpful is, the way our system works is our nurses or MAs will room the patients first. And I often will like tell the residents or med students, make sure you look at the chief complaint before you even walk in,
Hmm.
because oftentimes that additional problem on top of the well child is going to be stated there already.
Hmm. Hmm.
So if you do that before walking in, and your attending or a resident maybe that you're working with is available, you can always troubleshoot with them and say like, okay, I have a 2-year-old well child check, but they're actually bringing in a concern about constipation. What are some questions that I might ask? So you can kind of talk about those things beforehand so you can feel prepared before walking in. And of course, like it might change once you start the visit, but I think that's one way to feel confident in being like, I can address the well child check stuff plus this acute visit,
Hmm.
in a more limited time, which is a skill you have to obtain in general pediatrics.
Yeah. And you alluded to this a little bit, but I wanted to talk about, we have this picture in our head now of this honors level
Mhm.
student, maybe even
Mhm.
like a passing student, what sets you apart. So, what about what sets you apart in a negative way? And you
Mhm.
alluded to this a little bit of what stands out, but in the way you don't want to stand
Yeah.
out. I think the overarching theme that kind of comes away from a lot of other attendings that I've spoken to and with you as
Mhm.
well is this idea of disinterest. So
Mhm.
maybe we can talk a little bit about what does disinterest even look like, because maybe
Sure.
we'll give the benefit of the doubt and say that a student
Mhm.
doesn't even realize they're looking
Yeah.
disinterested. How do we see that? How do we perceive that?
Yeah. So I think I honestly I work with such lovely medical students and they always do such a great job and they're so professional. And so I think a big one is just like how you're interacting with me, the residents, faculty and staff, of course, and patients. That's always a given. But I will say, I am always looking for, things that we have discussed prior, whether I've worked with you 2, 3 days ago, are you actually implementing what we talked about?
Mhm.
I am very big on giving, on the ground feedback as much as possible. saying like, oh, that was a really great history. Maybe you should add this next time,
Hmm.
and seeing if you're able to incorporate that. So to me, if it's something that we talked about over and over, so for example, like let's say, sometimes it might happen in a 2 week rotation, outpatient, you're seeing 10 9 month olds, right? So at
Hmm.
this point, you're like, okay, I'm pretty good at the 9 month old well child check. So if there's something in particular that I talked with you about, and I was like, well, we really need to ask this question at the 9 month old checkup. But then by the end of the 2 weeks after, 15
Hmm.
visits, I still don't see that incorporated. It's not necessarily like you said, it may not be that you know that it comes off as disinterest, but it kind of shows like, okay, you're not really incorporating the feedback that I said. Maybe it's because you're not really prioritizing what you're learning on this rotation. So I think that's one thing beyond kind of the just being professional and knowing how to work with our very culturally diverse staff and patient population. I
Hmm.
think one that's really important is that if we've given you feedback or learning points and you have ways to incorporate it into the future of the rotation, please do so.
Yeah, that makes a lot of sense. I think
Mhm.
another thing too that students do that they might not realize comes across as disinterested or not like paying attention
Mhm.
is having their phones out. I feel like we
Oh,
all
yes.
we all do this. Like we're in a digital era and it's
Mhm.
almost impossible, right? Like we even just said that you can access Bright Futures, save it to your phone. So
Yep,
how
yep, yep.
do I show my team that I'm interested? And I
Mhm.
think a lot of that for in the ER is like you're asking, can I go see this patient? Or
Yeah.
can I get up and follow you to ask this history? Can I go back and look at it? And then if you're not seeing a patient, if you are researching something and
Yeah.
it is on your phone, then how do you make that look like what you're intending to do?
Yep.
And so I think like some great examples are if you even just tell the attending, hey, listen,
Mhm.
I'm going to look this up on my phone because I saw this
Mhm.
patient. I'm going to be looking this up, or I'm going to search this on the computer. I feel like
Yeah.
having that transparency so that someone who,
Mhm.
if they do see you looking something up, they don't assume that you're texting or checking social media.
Exactly, exactly. And I would say our med students are really good. I think they often will use their laptops, and I think the kind of maybe most like non-related thing to our rotation is sometimes they'll be doing questions, which
Hmm.
I totally understand, right? You want to be able to utilize some of your downtime to be able to practice some of those things as well. So I never disparage them for doing that. But yeah, just like you said, when I see them kind of looking things up to date about the patient we just saw, that can open a conversation for me to say, okay, what, like now that you've read that, what have you learned? Do you have any questions about it? Also, because so our med students primarily work with attendings in our attending clinic, but sometimes they're with residents as well. But either way, the residents have a morning and afternoon lecture, which I think is pretty common in most
Hmm.
Gen Peds clinics. So one way to show that you're really interested is participating within that lecture because that's a learning opportunity, right? You're learning alongside the residents. So being, as permissible, being involved in those clinic lectures. And even taking opportunities. I know we're kind of focusing like on the interest part, not the disinterest, but I think it's like be positive, not negative in pediatrics. But I think being interested in what different staff members in the clinic do is one
Hmm.
thing that you can actually show interest in. So, sometimes I'll tell, so for example, when we were doing a lecture on vision screening, and then I just went ahead and sent like the medical student, like, why don't you go look and utilize the tool that they use to do the vision screening for some of the children. So you don't always necessarily have to be, with the patient or with us as the attending. There's so many places within our clinic that you can learn, and I'm sure it's pretty similar in the ER as
Hmm.
well. So that's one way to show interest. If you're like, okay, this was a really cool chief complaint. So for example, like we are really lucky and we have lactation services in our clinic or like a dietitian. So you can say like, oh man, I didn't ask all the right questions for that Failure to Thrive kid, but is it okay if I stay with the dietitian so I can hear how she
Hmm.
talks about it? Like that is one thing that really shows me like, wow, you really care to learn. And you not only want to learn from me because you know that as physicians, we're not going to know everything, but we really need to utilize our other staff too. So that's one thing that has really stood out to me. And I'll often offer it to the medical students, but how enthusiastic they are about it will often show me
Hmm.
like, oh wow, they really are interested versus kind of like, it's okay.
Yeah. I think like our overarching message that I'm taking away from our powwow here is that
Mhm.
an honors level student is showing up, showing interest, and asking the why.
Exactly. Yeah, just be curious. Honestly, that's my life motto.
Yeah.
I think that if you are curious first, no one will ever disparage you for asking questions. And that's particularly true in medicine and academic medicine. You know, yeah, everybody will be excited if you just show that you're showing up by asking questions.
Yeah, I say a lot to our learners too. Like, I can teach you the material, but I can't teach
Mhm.
you to show up and be interested. Like, that comes innately
Exactly.
from you. And I think that's
Exactly.
what really sets you a leg above, even from the beginning.
Yeah, exactly. And we all have bad days. We totally get it. I don't feel so far from like the where the medical students and residents are, even though I've been out of training for a while. But I think it's just that, showing that progression over time is what makes the difference.
Yeah, definitely. Well, Stephanie, thank you so much for taking the
Of
time to chat with me
course.
today. I know that our listeners will be very appreciative of your insight. So thank you again.
You're so welcome. I hope it was helpful. Thank you for inviting me.